Awesome. Hi, my name's Heather David. I am the Alumni Relations Coordinator for NOLS, and I want to welcome you to the final event in the NOLS Wilderness Medicine virtual event series. Thank you so much for being part of the NOLS alumni community and for helping to make this full series such a success. Before we get started today, I'm going to review some logistics. First, these events are recorded, and the recordings for not only this event, but every event in this series will be shared in a follow-up email, which you should keep your eyes out for tomorrow. In order to make these events more accessible, we have an ASL interpreter, and there's closed captioning turned on for this event and for the past two events as well. During the presentation, Graham will be sharing his slides. In order to adjust the size of the slides and our presenter, Graham, and our ASL interpreter, you can slide the vertical gray line to your left. During the presentation, add your questions to the Q&A. Once we get started, I will be disabling the chat feature in order to streamline where you put your questions to one location, the Q&A. Robin and Kate, who are part of the NOLS Wilderness Medicine team, will be typing some responses to your questions throughout the presentation, with some time at the end for Graham to get to any questions that we might not have had time to answer. Without further ado, I would like to introduce Graham, who is the NOLS Wilderness Medicine Education Manager, to share the top items in your first aid kit.
Thanks, Heather. Hi, everybody. My name is Graham Prather, and I am calling in from Boulder, Colorado, where I am the education manager. I work remotely for NOLS Wilderness Medicine. I've been with the school since 2015, largely in the role of faculty member and teaching just this very topic. So excited to connect with you all as we head into the summer season, at least here in the Northern Hemisphere. So what we'll cover, NOLS incident data. So when I was getting ready to do this presentation, I thought it would be neat to take a look at our incident database. As most of you all may know, NOLS has been around for a while. We got our start in 1965. And in 1984, we started to put our heads together and say, hey, we should start capturing data. So I'm going to take a couple minutes to look at the slides and see what if we were building a first aid kit off of what we actually see at NOLS Wilderness Medicine and NOLS Field Expeditions, what should we be prepared for? Then we'll look at first aid kit common contents, some of the over-the-counter medications that you might find, and then some basic prescription drugs. However, just a little caveat, these are prescription meds and should be covered or carried by the participants, the clients, or your friends to whom they are prescribed. And then we'll have a little bit of time for questions and answers. All right. So what gets us sick in the backcountry? Looking at the NOLS illness database, so from the incident database, if we look at 2005 to 2022, the biggest part of this chart is communicable disease. So things that we can communicate between one another. And the red, if you're able to see this in color, the red represents gastrointestinal illnesses. So that's the largest section just by itself, and then other flu-like illnesses, et cetera, fill out the communicable disease. Then coming in, not even really a close second, is allergies. But if you look a little further down, maybe about halfway, you'll see that anaphylaxis has its own category. So when we say allergies, we're not necessarily referencing a need for an EpiPen. More likely, we need something over the counter. And then a few others, urinary, reproductive, and abdominal are all up near the top. So that's an interesting thing to think about when it comes to what's in your first aid kit and what kind of illnesses are you likely to encounter. When it comes to what gets us hurt in terms of injuries, athletic injuries lead the way, followed by soft tissue. Now, we mean by soft tissue, we mean like cuts, scrapes, bumps, and bruises. Athletic would refer to things that aren't broken, because if you look a little further down, you'll see fractures are towards the bottom of the chart. And so they're delineated between athletic and fractures. So we're talking like sprained ankles, unusable or usable knee injuries, and the likes of that. Um, it gets tricky here because with the soft tissue, this number would actually win out if we were considering blisters. Blisters don't always get reported. If it's a big enough blister to evacuate a student from the field, yes, that gets its own paperwork. Otherwise, it's probably not getting captured in this data. So you might even think of flipping this if you were going to lump blisters into soft tissue injuries. A third, and this was kind of surprising to me looking at the data, but dental was our third biggest reason for getting an incident report filled out. So we'll talk a little bit about that and what we can do in our first aid kit. So some data takeaways, just looking at the last 4 years, 5% of students get injured, 8% of students become ill. And then looking at sort of the evacuations in terms of illness, roughly a third of those get evacuated. Whereas in terms of illnesses, it's about a quarter. So in terms of medical issues, when we're building a first aid kit and we're checking the medications that are in there, we should be ready for gastrointestinal illnesses, issues. And just a quick reminder, washing your hands is going to be a really big preventative piece that we can do to hopefully avoid some of those GI issues, along with like not letting somebody that's sick cook your food, making sure that you have the bathroom separate from the cooking area. And just another kind of shout out to training itself is when I teach GI issues, I think of the belly or abdominal, urinary, and reproductive issues being a big black box of mystery. And for that, I like to really rely on my evacuation guidelines to help me make the right decision on whether this tummy ache can stay in the field a little bit longer and see if it gets better, or is this something that we really probably should be getting checked out by somebody with a lot more training than us? In terms of injuries, rolled ankles and cuts and bumps and bruises and blister prevention should be things that we're looking at to keep in our first aid kit. And then for dental emergencies, that can be a little bit more tricky. Obviously, if you've ever had a cavity or a root canal, you know that it's not a fun place to be in the backcountry if you're dealing with that. So we're likely evacuating just for comfort and pain. So looking at common contents. So this is pulled directly from the NOLS Wilderness Medicine Handbook. If you're a wilderness first responder, you already have access to this in your handbook. But things that we're looking at are big picture items like trauma shears. That's a cutting device. Ideally, when we're cutting bandages or tape, we want to avoid using sharp, pointy knives anywhere near skin. So these blunt-nosed scissors can be helpful. Tweezers are invaluable. They're going to allow us to get out debris and lacerations, pull out cactus needles a lot more easily. Safety pins can also help us dig things out if we keep those nice and clean. Having some kind of documentation, especially if you're in a work capacity, so those patient assessment forms or a SOAP report that's easy to fill out, especially if you're not giving medical care on a regular basis. Having some kind of form to help you remember to fill in all the boxes makes a lot of sense to me. If we're going to be on an extended trip, having some kind of thermometer, and then some basic emergency supplies like a pocket mask in case we need to do CPR, emergency blankets, and then we get into wound dressings. So things like second skin for burns, antibiotic ointment packets that can help us keep our dressings moist and clean, different sizes of bandages, Band-Aids. A lot of people will ask me, like, what's the biggest thing that I should bring in my first aid kit for wounds? And I'm like, it's probably a Band-Aid. I have a toddler at home, so having Elmo Band-Aids or Sesame Street or anything with a digger on it is going to be a surefire hit in my household. And then there's a variety of other size pads, tapes, wraps that can be helpful. Last in this column, we'll see the SAM splint or a wire splint that can be helpful for building out a splint if we have an unusable musculoskeletal injury. Then getting into the wound care itself, remembering that gloves are important, especially from a body substance isolation perspective, and also from keeping everything clean. A irrigation syringe, so one of those little small syringes that you probably saw in a wilderness medicine class, to fill up with clean enough water, and then you can squirt it into a laceration to help flush out any debris or any germs. Generally, when we're using an irrigation syringe, just a reminder, we tend to advocate for at least a half a liter of water in a small laceration on the arm, even if it's just an inch or two long. We want to use about a half a liter with that irrigation syringe, always going in the same direction. And then different types of cleaning supplies, povidone iodine, antiseptic towelettes, scrub brushes. And then you can get into some of the more advanced things like blister dressings. Jim Wynn last week talked about those. So if you didn't get a chance to catch the blister talk, hopefully you'll be able to see that here really soon when these all get emailed out. And then again, a variety of other dressings for taking care of those soft tissue injuries are going to be useful. When it comes to blisters and hot spots, here's a variety of different names that Jim talked about, and also maybe you might want to look into. When it comes to blisters, Band-Aids, let's not underestimate the power of a good Band-Aid. And if you're not sure what a good Band-Aid is versus a not so good Band-Aid, it generally has something to do with the price tag. The more expensive, higher quality Band-Aids will stay on, generally speaking, better than the really cheap ones. We may also want to keep some petroleum jelly or some tincture of benzoin. Petroleum jelly can help cover a blister, like Jim was talking about. Tincture of benzoin is like medical grade tree sap. It comes in a little vial or a little jar. It's sticky. We talked about this a little bit in the past presentations, but it can also cause a skin reaction in some individuals. So just be cautious with that. If somebody is having like a rash or a reaction to this sticky stuff that we're using to help keep the bandages on, we should get it off and wash it with soap and water. Dental, there's a variety of different dental waxes out there in the wilderness medicine curriculum. We talk a lot about Cavit. I've also heard of, I think, Dentec. You can find in the pharmacy aisles. It's basically a temporary filling. So if you have a cavity or a filling that has come out and you need to cover that because exposed to the air or to drinking water causes you pain, if you can cover that, that's great. Sugarless gum can also work really well for our dental emergencies. If we're on a really extended trip, I might consider carrying some kind of balanced salt solution like Hank's, sometimes seen as Save a Tooth. If a tooth gets knocked out, you could store the tooth in this solution while you evacuate to an emergency dentist. And hopefully, if you can get there in enough time, they may be able to get that actual tooth back in. Otherwise, in our dental curriculum, we recommend milk from animals, especially cows, can be helpful for storing knocked out teeth. One of our instructors, Dan Zacks, who's a retired flight paramedic, he likes to carry around one of those like small mirrors, which can be helpful for getting in the mouth, like the kind you see your dental hygienist using when you go to get your teeth cleaned. Can allow you to get back in there and look around. Also could be potentially useful in signaling a helicopter, having a small mirror that you can utilize for that. When it comes to bleeding control specialties, we generally don't say everybody should carry a tourniquet. Tourniquets are going to be really helpful for those that work around equipment that can cause life-threatening bleeds like chainsaws or firearms. So when I worked as a wildland firefighter, you better believe I had a tourniquet very close by, if not in my pocket. But if I'm just out for a day hike, I'm probably not taking a tourniquet. Additionally, hemostatic gauze. So you may have seen stuff like Quick Clot in like the aisle at your local outfitter in the first aid section, which is a powder. They make these gauze wraps that you have that are impregnated with that chemical, and it helps to potentially slow down the bleeding a little bit. But if you remember back to any of your wilderness medicine training with NOLS, we try and really focus on direct pressure and elevation. And a hemostatic gauze, while it might be nice, direct pressure and elevation is doing most of the work for most of our bleeds. And then, yeah, if I'm working around firearms, carrying a commercial chest seal could be really helpful for those those types of injuries. Okay, so let's take a look at some of the common over-the-counter and some of a couple of prescription drugs that we might see. So when it comes to pain relievers, the non-steroidal anti-inflammatory drugs, or NSAIDs, and Tylenol, which its generic name is acetaminophen, are some of the bigger ones. So I tend to carry Tylenol. That can work in a lot of different environments and can be taken simultaneously with ibuprofen and can increase the ability to manage pain. I also really like aspirin. It works well as an NSAID, but also can be useful if we're seeing some kind of cardiac emergency. When it comes to the gut, looking at antiemetics, antacids, and antidiarrheals, things like Tums, Pepto-Bismol for the trade names, and Imodium can be really helpful. I've definitely had Imodium save my butt in the backcountry a couple times. Nobody likes diarrhea. It's just not a pleasant thing to deal with. And if you're needing to evacuate because of that, being able to manage that can be a useful tool. In terms of antifungal, if we're on a really long trip, yeah, fungal infections can set up in those dark, warm places. So remembering that and trying some preventative or reactive medicine with like tufactin, tinactin could be helpful. And then as far as antibiotics go, we generally only talk about the double or triple antibiotic ointments. If we're needing oral antibiotics, remember that's a prescription medicine. So if somebody has a systemic infection, they need a prescription in the US to utilize something like amoxicillin for like pneumonia. Hopefully we're not coming across that in the backcountry, but just in case. With anti-allergy, epinephrine is our big one for anaphylaxis. Again, another prescription drug. So hopefully making sure that our participants are showing up with their prescribed meds is helpful, especially if we're in a work capacity. But also not a bad idea to check with your friends. If you know somebody is really allergic to bees and it's summertime, it may be nice to have that EpiPen not forgotten back in the car. And then basic over-the-counter antihistamines. We're starting to see a whole bunch, well, not starting, but there has been a lot of different antihistamines on the market in the 20 or so years that I've been paying attention to this stuff. Benadryl or diphenhydramine is kind of the first generation. It's really effective, especially at skin issues. But what's the side effect of Benadryl is that it often makes us drowsy. And so if we are having an allergic reaction and we need to get out relatively quickly, that can make it a little challenging if you're feeling a little droopy-eyed on the hike out. So those second generation like Claritin, Zyrtec, Allegra, or the generic versions of them that you see in the pharmacy aisle can be really helpful and effective. They may not kick in quite as fast, but they aren't going to have nearly the side effects that we would expect to see from Benadryl. And then two more that are RX drugs, bronchodilator, or what's going to open up the airway, is albuterol. That's classically your inhaler. So really hard thing to replicate in the backcountry if you don't have that medication and you forgot it back in the car at the trailhead. So try and remember to bring that. And then if you are considering going to high elevation, maybe consider having and you know that you're susceptible to altitude related issues, you may want to have a conversation with your travel healthcare provider about maybe getting a prescription for acetazolamide. It's classically taken prophylactically. So right as we're about to start going into the mountains, we start to take it. And basically what it does is it tweaks your blood chemistry to where you breathe a little faster, which helps with the acclimatization process. In terms of best practices for any of these medications, check expiration dates. I always like to get my first aid kits out at the beginning of the season and make sure that all my meds are not expired. They didn't get sat on in a backpack and crushed. Make sure that you're following temperature requirements. Things like epinephrine don't like to be stuck in the glove compartment of a hot car on a summer day. So make sure you're storing things at the right temperature. If you're carrying prescription meds, consider the implications of if you get lost or separated from them. When I worked as a raft guide, you might put the patient's insulin in their raft, but also have like a backup supply in a second raft in case we flip and we lose all our supplies. So carrying extra. Read the forms. Traveling internationally, and just a shout out to those travel health code providers. They can be really helpful in helping navigate, oh, I'm going to this country. What vaccinations might be helpful for me from a prophylactic or preventative standpoint? So don't be afraid to ask. Some closing thoughts. Really, the perfect first aid kit doesn't exist. When I am looking to buy a first aid kit, I'm probably going to buy a bigger one. And why do I say that? This is our med kit 4.0. If I need something out of here for a day hike, I could also get like a small little baggie and pull out what I need from this and put it in here. We offer on the NOLS store a variety of different sizes, but I like a big one so that I have extras, I have backup supplies. It's generally going to be cheaper to buy a prefab kit off the shelf. So go to your local outfitter. If you have a dividend at a certain, REI, you could use that to purchase a first aid kit, and then consider like separating out a small portion for your trail runs or your afternoon day hikes when you want maybe just something for a little bleeding control, a pair of gloves, and maybe a couple, allergy medicines or whatever you think you need, or a roll of tape. And you keep that in the small one right here. And then when you go on that big, 2 week long backpacking trip with 4 other people, you bring this one and you just slide this one inside of here. Another one that I really like, and like I said, they're not perfect. I took essentially the contents of one of those 3.0s and I put it inside of a Nalgene, clean Nalgene that I've never drank out of. And inside it's got all the stuff that I need for bleeding control on the top. Towards the bottom, I've got more of the stuff that if we're going to be here for a while, I don't need it in a hurry. But what I like about this setup is that it's relatively crush proof. If I sit on this in my pack, I know I'm not going to crush my Benadryl or my tincture of benzoin. And it's relatively waterproof as well. When I was a whitewater boater, I would be able to clip this back behind me in the back of my kayak, and it would always be there. And as long as I didn't lose my boat, I always had my first aid kit. Really though, the big thing with first aid kit, the most important thing in your first aid kit is right here, between your ears, behind your eyes, and that's your brain. So a good first aid kit really needs some kind of training and understanding around what to do with those tools to hopefully help keep you out there healthy and safe, playing in the backcountry and not necessarily going to the hospital when you don't need to, but also being able to recognize like, hey, this is above my head. This is above my pay grade. Let's get this person out of here because the training that I have isn't adequate to really take care of this person. So knowledge, training, that's the big sales pitch that I would say. If you haven't looked into a wilderness medicine course and you're considering like, yeah, I want to get a first aid kit, that's great. You should do that. And also come see us for a class. Because because I think what we do is pretty awesome. I wouldn't have been with the school for almost 10 years if I didn't believe in what we do. Lastly, I'll say, as my gift to you, if you go to the NOLS store, nols.edu, and click on the store, and you're looking for a first aid kit, you can use NOLS free ship, all one word, to get some free shipping. And yeah, there's a variety of different sizes. There's also restocks if your first aid kit is looking a little shabby. Maybe it needs a little freshen up, some spring cleaning. Go ahead and take a look there. And my hope is that you don't ever need it. Practicing good risk management out there in the field. But if you do, that first aid kit is there to serve you. I think that's what I got. Happy to take some questions.
One question that just came in, is do you put a liner in the Nalgene bottle for temperature control when in the elements?
No, I haven't put a liner in there. No, that could be a great idea. It would make it a little heavy, but you could use an insulated water bottle if you were concerned about temperatures.
I know there were a couple of other questions too regarding like how you decide the size of your first aid kit and the essentials, like depending on the activity that you're going out to do.
Yeah, I mean, a lot of it's going to be like how many people am I with, and also like how far or how long do I think I'm going to be gone. So something like a day hike, I'm probably not carrying a whole lot of stuff. If I know I'm a mile or two from the car, I'm probably not doing a lot of wound cleaning in the field. Maybe I'm washing it off, but I'm not. If I'm hiking back out to the car, I'm gonna leave and go home and take care of that. Whereas if I'm going, a day's journey or a half a day's journey into the wilderness, and I think it's going to be a much trickier evacuation if something happens, then I'm probably going heavier on the first aid kit. But ultimately, I think we could probably have this debate over adult beverages for many, many evenings in a row and probably not come up with a perfect answer. I think it's everybody's individual risk tolerance is going to dictate to some degree how much they want to carry. There's definitely the light and fast crowd that swears by just bring a roll of duct tape. That's all you need for a first aid kit. And then there's people like me that are going to come with a little bit more preparedness, but it's a balancing act.
Awesome. Thank you. Also, there's a question, if you're bringing your dog or a pet with you, are there specific items that you should bring for them?
For the most part, I have two dogs. Your basic human first aid kit will work pretty well. It won't work for medications, but in terms of wound care, definitely bringing tweezers. I have pulled out, I don't know how many porcupine quills out of my dog's face in the past, and tweezers make life a lot easier. Multipliers are actually a pretty awesome choice for that as well. But Coban, so it's a stretchy wrap. If you go to like a tractor store or a farming store, you might see it in the vet section around the horse stuff. It's called vet wrap, and it's like this stretchy material that adheres to itself. If your dog has ever gotten like an IV and you've seen like their arm was shaved and they had like that stuff wrapped around it, it was kind of stretchy. That's what I'm talking about. So I would bring that and maybe some gauze as well to help take care of any cuts or scrapes that the dog has. But essentially, it's the same treatment. You want to keep the wound clean, or you want to get the wound clean and then keep it clean as possible if they do get cut.
Awesome. There was a question too about rehydration mixes. If you recommend anything like that, what your recommendations are.
In general, if we're just staying on top of our hydration, it's going to just be your personal preference. If there's something that's going to help you stay hydrated because it tastes better and you're not a big fan of water, which no judgment there, you should take whatever you need to take to keep you drinking. However, in terms of like if we really get behind the proverbial 8 ball and get dehydrated, yeah, um something small could be helpful. We generally, I think our textbook says like you could put a little bit of salt in somebody's drinking water, just like a half a teaspoon, just a splash, to help them rehydrate. Or you could use some of those over-the-counter things. But ultimately, if we're doing a good job with our nutrition and drinking water, those two together should keep us pretty happy.
Awesome. Um, question, like somewhat related to first aid kits. If there's a fungal infection or another infection that someone has, like how are you identifying those things and what items do you need for those in your first aid kit?
Mm. Um, well, fungal infections and other infections I would treat different.
Mhm.
A fungal infection, I would probably need to just keep it clean, keep it dry, air it out as much as possible, and hopefully I have some over-the-counter antifungal medications to help with the discomfort that that can cause. If I'm seeing like a staph infection or some kind of wound that has become infected, for that, we would generally say if it's in the more mild category, we want to clean it. We want to do essentially warm, like hot tub temperature soaks 2 to 3 times a day for 20 to 30 minutes on the actual wound itself, and then re-clean, redress it with uh, new bandages. But if it looks like it's spreading, we're starting to see systemic things like streaking away from the wound, redness, the redness continues to grow, or we're seeing like lymph nodes that are swollen or anything like a fever, that person needs to get out of there really quickly. So while I'm still going to try and do those hot soaks that I was talking about and cleaning and redressing the wound, the main focus I probably have for this patient at that time is evacuation. Um, yeah.
Cool. And I think the final question that we have time for, someone asked if they have honey versus petroleum jelly with them, does that work to keep their wounds moist?
Yeah. Honey has been studied and it does have some healing properties. I've tried it on myself, particularly the Manuka honey out of New Zealand. Seems to have the highest levels of antimicrobial hydrogen peroxide combinations. Um, with table honey, or over the counter, bought it at the Safeway down the street kind of honey, it may not be as clean as you think it is. We're hesitant to recommend that. It can help keep it moist, and if that's all I have, that might be what I try. But they do make medical grade honey, um, that you can buy in the pharmacy and apply to wounds, and it seems to work pretty well from the studies that I've read.
Awesome. Thank you. Thank you for answering questions and for joining us today at this event or at any of the previous two events that we did as well. Tomorrow, you will see a follow-up email from me that will include a link to the recording of this event and the past two events as well. Anyone who RSVP'd is on that list, including if you RSVP'd maybe or no. So if you did not RSVP, go back and do that so that you make sure that you will get that email. Thank you again for attending and helping to make these events and this full series such a success. And a huge thank you to Graham and NOLS Wilderness Medicine for making this refresher on first aid kits available, and all of the refreshers that we did available as well. So thank you so much. Have a great day.